All right, my name is Rosemary, and today we are going to be talking about brain lesions. Two things before I start. I have roommates, and they have decided to do a lot of weird stuff tonight, so that explains all the background noise. So sorry about that. Ignore it. And if I start speed talking and mumbling or saying a lot, it's probably because I'm nervous. So bear with me. All right, let's get started. So, brain lesions, what are they? They are any type of abnormal tissue in or on the brain normally caused by a disease or an injury. So, when I first started this project, I thought brain lesions were just one thing, one big thing that happened to your brain. But no, it turns out it's a whole bunch of different things that happens to the brain. So, there's so many different types. There are traumatic brain injuries, infectious, malignant, benign, cancerous, non-cancerous, vascular genetics, because some people are born with brain lesions. Imagine that, right? Brain cell death or malfunction. And sometimes you can even get it from ionizing radiation, which I found pretty intense too. This whole topic was intense. So there are two ways that you can find out if you have a brain lesion, and that is by getting an MRI scan or a CT scan. Those are the only two ways, and only a doctor can tell you if you have a brain lesion or not. You can't just sit there and say, oh, I have a headache, must have a lesion. No, that's not it. You actually have to go in and get a scan done so they can, get a picture, kind of like this one here, and a dark or light spot will appear, and that's how they'll know if you have something going on up there. So I decided to talk about two different types of lesion today, and they are the traumatic brain injury lesion and the vascular lesions in children. Alright, so traumatic brain injury. This injury occurs when your head unfortunately meets a blunt force, for example, a gunshot to the head, which causes the object to pierce into the skull, then enters the brain tissue, which disrupts the normal function of the brain. So this lesion pretty much happens when something interrupts your brain from doing its normal job, and that can be all sorts of different things. If you look at this chart I have here, slips and falls can cause a brain injury. An accident, struck by or against, assault or battery. Unknown, I wonder what that could be. Wouldn't unknown and other be kind of like the same thing? Anyways, I took care of a guy. In my last facility, I took care of a guy. He was a doctor. He slipped on ice one day and smashed his head to the concrete. So, blood gushing everywhere. I think there was a huge gash in his head because he had to get surgery to get that covered up. So that happens, or there are different ways that you can get a brain injury. Depending on how much damage you have happened to your brain, it depends on what kind of symptoms you'll get. It could be mild, moderate, or severe. Like in that guy's case, it was a severe case because he smashed his head wide open, blood gushing everywhere. His brain was probably hanging out of his head. I'm not quite sure. But he did have to get a lot of surgery. He was in and out of the hospital for years. I'm not sure how he's doing now. Hopefully good. But so depending on how much damage happens to your brain, that could be it. When I was younger, I got hit in the head with a rock, So I would say that would be a mild case, because the rock didn't pierce into my skull. It just kind of hit me in the head. I did have a bit of a concussion after that, but like I said, it wasn't anything too dramatic. So I was thinking about this a lot, and I decided to rate it. A concussion is mild, a coma is moderate, and when you have to get brain surgery, it would be severe. Some symptoms include vomiting, uh, headaches, confusion, coma, loss of consciousness, moderate, mild, severe. A serious injury to the head usually includes a trip to the emergency room. Yes, probably because you're gushing blood out of your brain, and that's not okay. There are things you could do that could prevent you from getting a brain injury. I think this is the only lesion that can actually be prevented, or you could try to prevent. You could do things safer, like when you're driving, don't text, pay attention to your surroundings and what you're doing, you know. Maybe don't go into a bad neighborhood where you can get shot. Maybe your favorite candy store is in a bad neighborhood and you just have to go there. Well, try not to because you might get shot. Just saying. So that's a way you can prevent yourself from getting traumatic brain injuries. So our next lesion is vascular lesions in children. I know this picture is a bit intense, but bear with me. I chose this one because it really shows the pain the child is in. And I mean, look at that. That's one intense lesion right there. So this lesion affects infants, newborns, growing children. The symptoms appear almost instantly, and suddenly that the condition can be life-threatening, but thankfully it can be successfully treated by a team of physicians. So there are 4 different types of vascular lesions that I'll be talking about today. Aneurysms. Aneurysms happen when the major artery branch off into small arteries that then rupture, and that's normally when they find out something's wrong with the baby, because it tends to like intense a headache or give the infant or newborn a really bad headache, and kids don't deal well with stuff like that, so they start crying and crying and crying, so you almost have to take them into the hospital to figure out what's wrong. And that's when they find out, you know, your small child is having an aneurysm. You know, you should probably do something about it. The next one is arteriovenous malformation, AVS. Excuse me, I completely butchered that. AVS are arteries that supply the brain with nutrition. When this happens, blood enters the brain with so much pressure that it causes the vein to explode, and that is what leads to a stroke. So this is a vascular lesion that leads to kids having strokes, which is pretty intense if you think about it. Like, you would think that's something that only happens in adults, you know, like the elderly, but some kids get born and it's like, whoop, they're having a stroke. It's real unfortunate. The next vascular lesion I will be talking about is cavernous malformation. Completely butchered that too. I'm so sorry. But these are the most common lesions in children. It's not all that life-threatening, but this lesion slowly leaks blood into the veins. The leaking blood irritates the area around the cavernous, and that's what causes seizures. So this lesion is what causes kids to have seizures. And this lesion, wow, excuse me, this lesion can be it can be removed, but removing it is a lot more riskier than having it. So it's almost like it's kind of either or. You know, you could either leave it in and keep letting your child have seizures that, you know, you can maintain and get meds for, or you could take it out and risk something even worse happening to your small child. So, you know, for parents who have to go through that or deal with that, I feel really bad for them, because that's a pretty intense, you know, decision to make. There's no really up or down for that. And then the last lesion I want to talk about, well, the last vascular lesion in children I want to talk about is this is a fun name, Meiomyia. It's called the Meiomyia disease, and I found this one all sorts of interesting, not just because of the name, but because at first this lesion was found in only kids of Japanese descent. It has to do with the carotid artery, 2 of the biggest vessels of the brain. This lesion also ends in a stroke, but after that, the brain starts to make small collateral vessels that look like little puffs of smoke on the X-ray. I really wish I could have gotten a picture of that, because that would have been pretty intense. It would have looked kind of cool too, I think. But that's where they got the name from, because Moyoyama means puff of smoke in Japanese. So that's where they got the name from. And all 4 of these lesions tend to have the same symptoms, but you know, some of them have more of it and some have less of it. So they have seizures, you know. Sometimes they put the kid in a coma, but that could either be a coma that they went into themselves or a coma that was induced by whoever their caretaker was to try to see if they could, you know, help them more by inducing a coma. Aphasia, mood changes, and, you know, of course, a stroke. That tends to happen with some of these vascular lesions. So that is all I have for you today. I hope that didn't run too long. So vascular lesions or brain lesions altogether, I found this topic to be a lot more interesting than I anticipated. You know, they are something abnormal that happens to your brain that causes the normal function to stop. So thank you for joining me in this assignment. Have a good night. My citation page.